So in the interest of time, we're going to move on to our last speaker, Dr. Takuya Tsuruoka, who's going to be speaking on zinc deficiency impairs ischemia-induced angiogenesis. Dr. Tsuruoka.
Thank you very much for the introduction and for reviewing our publishing our manuscript. Ph.D. is increasing globally. In no less than half of Ph.D. patients with chronic limb-threatening ischemia, CLTI, amputation of the affected limb is required, which reduces patients' quality of life. Zinc is an important essential trace metal that is involved in many physiologic functions. Some major health impacts of zinc deficiency include reduced growth rates and immune function suppression. With regard to cardiovascular disease, a high zinc intake status provides protection against cardiovascular disease. Recently, we investigated the relationship between zinc deficiency and clinical outcomes after bypass surgery for CLTI, and found that zinc deficiency is associated with lower rate of limb salvage. However, there is a lack of clarity on the impact of zinc deficiency in the regulation of angiogenesis. Here, we investigate the impact of zinc deficiency on ischemia-induced revascularization process, employing a mirroring hindlimb ischemia model, and also examine the relationship between circulating zinc levels and SPP as an index of tissue blood perfusion in patients with CLTI. Zinc deficiency was induced to a zinc-deficient diet to 3-week-old animals for 7 weeks. As shown on this slide, the zinc-deficient mice exhibit impaired blood flow recovery rate and decreases capillary density in the ischemic limb compared to the control wild-type mice. We next investigate the production of ROS in the ischemic muscle. Ischemic injury increases the ROS production rates in the adductor muscle to a greater extent in the zinc deficient mice than in the control mice. The serum level of D-LOM, an index of oxidative stress, was significantly greater in the zinc deficient mice than in the control mice. Furthermore, the zinc deficient mice showed higher expression levels of NADPH oxidase competence compared to the control mice. To examine whether excessive ROS production is involved in reducing the angiogenesis capacity caused by zinc deficiency, mice were treated with both a zinc deficient diet and the NADPH oxidase inhibitor apocynin in drinking water from 3 weeks of age. As shown in this slide, NADPH oxidase inhibitor ameliorated the zinc deficient induced impaired of revascularization. Finally, we examined the relationship between serum zinc levels and SPP as an index of tissue blood perfusion in patients with CLTI. This slide shows the clinical characteristics of the patients. Serum zinc levels are possibly associated with SPP in the CLTI patients. Multivariate regression analysis also revealed the serum zinc levels are significantly correlated with SPP in patients with CLTI. In summary, zinc deficiency contributed to impaired revascularization rates in response to tissue ischemia. Zinc deficiency led to an increase in the production of ROS. NADPH oxidase inhibitor ameliorated the zinc deficient induced impairment of revascularization. Serum zinc levels were positively associated with SPP in patients with CLTI. In conclusion, zinc deficiency impairs the rate of revascularization in response to tissue ischemia, which is accompanied by oxidative damage. Nutritional approaches aimed to add the zinc take of zinc may be useful for prevention and or treatment of ischemic limb damage. Thank you for your attention.
So Dr. Tsuruoka, other than using the NADPH inhibitor, did you have any other evidence that zinc deficiency was associated with elevated reactive oxygen species, like measuring plasma superoxide dismutase?
Thank you, great question. In our study, DRO measurement and digitalization staining are performed to evaluate the ROS of zinc deficiency model. We have not measured the SOD activity, but we believe that the evaluation of active oxygen expression by digitalization staining can be used as a substitute. However, since the digitalization staining has not been quantified, it cannot be shown as a graph. Also, although not shown here, we measure the ELISA of nitrotyrosine. Nitrotyrosine is a marker of nitric oxide derivative radical tissue damage. This study also showed the increase in plasma nitrotyrosine is a zinc deficiency model.
So the next question is kind of building after Dr. McEnany's demonstration that, capillary angiogenesis is kind of dependent on a lot of factors, including muscle fiber regeneration versus fibrosis. Do you have any other measurement of arteriogenesis as opposed to angiogenesis, like smooth muscle actin staining or micro CT in your model?
Thank you for a good question. We have traditionally evaluated limb perfusion by laser Doppler flow and evaluation by CD31 immunostain. And we believe that the actual accuracy is high because it is an established procedure. Therefore, we evaluate angiogenesis by performing CD31 immunostain and quantifying per muscle fiber. But we did not evaluate the density of muscle fiber itself or actin. As you asked, many factors are involved in angiogenesis. So in order to make a more accurate evaluation, it is desirable to evaluate actin by fluorescence staining and image evaluation by micro-CT.
Have you tried to supplement your patients, your Ph.D. patients with zinc?
We tried now, and Dr. Kodama in Circulation Journal, we showed the data.